The only thing worse than a broken condom. Get ready to laugh and hopefully learn a little, because today we are back at it, breaking down and reacting to what I am told are dark medical memes. This should be interesting. All right, let's dive right in. Dumbledore, yes, who does not like Harry Potter? Okay, at least I understood that one, right? Dumbledore, but because he's jacked. Look at those arms, biceps. I love the good photoshopping going on here of Dumbledore onto some guy who is actually shredded and ripped. So very good. Dumbbell, been using a lot of dumbbells. And shout out to him, rest in peace, he recently passed away. The doctor waiting for the parents to stop crying about their dead son so he can announce the $300,000 medical bill. That doesn't happen. These are absurd. Yes, I understand people are obsessed with talking about how expensive healthcare is and yada, 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 yada. There are many different factors that are involved in that, having to do with hospital administration and different costs. If you have insurance, not insurance, if you pay insurance, if you don't pay insurance. Physicians don't have any part of that, especially in a hospital setting. We don't know what things potentially cost. We have a rough idea, but we are trained and we are actually to do what is necessary to appropriately treat individuals, not try to do too much to charge individuals. When you are about to fall asleep, but your body does the fake fall thing. Oh yeah. There is the one where you're falling and then you do this jerk, and it's actually called the hypnic jerk, and it happens right before you're about to fall asleep. Some people have it happen more often than others, but it is not dangerous, but it is very freaky. Have you guys ever experienced a hypnic jerk? Let me know in the comments. Doctors, when they hear the patient has a rare disease, we're just nerds at heart, and we like science, we like anatomy, we like understanding disease processes, and thus we get interested in understanding and learning about rare diseases and processes. So yes, we get a little maybe giggly on the inside. Hopefully you're not showing it on the outside, and hopefully you have good bedside manner as well as good composure to then appropriately discuss these rare diseases with individuals. Sometimes patients who know they have a rare disease will even say, hey, there's a rare disease, you may or may not know about it. A human fetus at 12 weeks. Still think abortion isn't murder? You disgust me. A 12-week fetus, well, you're still in the first trimester, but yes, it has a heartbeat, it has most structures, and so, you know, there's many different reasons for, many different reasons against from a medical standpoint. You wouldn't have a full-grown face, obviously, on a fetus at 12 weeks. Typically, people get ultrasounds to look at anatomy around 12 to 14 weeks. It will vary, maybe 11 to 13 weeks. In the emergency department, we see a ton of people who come in early in pregnancy, typically because of bleeding, and so they'll come in early trimester, maybe 5-6 weeks with bleeding, and so sometimes that's the more common period of time when you would actually have a spontaneous abortion or miscarriage. How pumpkins poop. That is what we call a colostomy bag. When somebody has a colostomy, meaning that they've had their large intestine, so your colon, is cut. And so say it's cut and not put back together. Sometimes they do that to seal off the one end to allow certain types of healing. And then you have to divert the fecal material out of the body somewhere because it's not going out your butthole. So it goes out a bag, usually on the anterior aspect of your abdomen. A lot of times why you would have this, a perforation of the bowels, cancer, twisting of the bowels, if you have really bad diverticulitis and diverticulosis. All this chemo made me so emo. So they're talking about chemo meaning chemotherapy, meaning treatment for cancer. So emo, short for emotional, hence the image. But it was also like a type of punk music. Chemotherapy is used to treat cancers, but what is chemotherapy? It's basically medications that we give either intravenously or by a pill that is basically toxic in an appropriate way, in the sense of it's trying to kill and stop the growth of rapid dividing cancer cells. Pollen waiting on me outside so it can kick my ass. Okay, pollen, yes, outside. People might be allergic to pollen. It might be an irritant. Some individuals are super allergic to it. They get what's called allergic rhinitis. They always have a runny nose, red eyes, itchy eyes, sneezing, coughing, and typically are treated with antihistamines or allergy medications. Some common ones would be like Allegra or Claritin. Pollen comes from flowers, so if you live in a lush area, you may have a high chance of a lot of pollen being around. I'm not an expert, but I don't think Karen is gonna make it. This is a mannequin. They're just having space from each other, so they're doing the look, listen, and feel of an unresponsive patient, aka mannequin, on the ground. So the first one by the head is doing the look, listen, feel, and maybe feeling the carotid artery, which is the major blood vessel here on the neck on either side, and then maybe giving some rescue breaths. And then the other individual is ready and in the hands CPR position for chest compressions to do 100 per minute using the palm of your hand, center of the chest between the nipples, right over the sternum. Fill your cup day at 7-Eleven. That is gross. So these are actually urinals that we give to male patients in the hospital, especially in the emergency department, when they can't get up and walk because they might fall. We're worried about them. We need to keep them on a monitor. Many different reasons why. I hope they are unused. I hope they're not recycled either. When your isolation patient touches you. People get into isolation rooms for multiple reasons. We have contact isolation, aerosolized, basically droplet, or airborne. I like your curves. Thanks. I got it from neglecting to raise the bed when doing bedside procedures. Oh, that's really funny. So you can see this abnormal curvature of the cervical spine and thoracic spine, especially at the junction, right? So your thoracic spine is the spine relating to your thorax, and that should be kyphotic. So there should be that arch, but your neck, your C-spine should come back up in a lordotic position and go back the other direction. This is more leaning forward. I am guilty of sometimes not raising the bed for a procedure and I'm bent over more. Usually it's more bending from my lower back than from my neck. We have to worry about appropriate posture and being in the right position so we don't hurt ourselves. When you finally get a difficult patient discharged and they show up the next day. I don't want to say it's very common, but this does happen. In the emergency department, we call them frequent flyers for many different reasons. Sometimes it's social, sometimes it is medical, and sometimes it's due to a lack of follow-up. Many different reasons why. Obviously, emergency department doors are wide open. You come on in, we will see you by law. We have to do a medical screening eval on you. But yep, some people just want to come to the emergency department often. Difficult patients for whatever reasons. We have case management, social workers, a lot of different people at the hospital help with these different types of situations. The only thing worse than a broken condom. Broken condom could increase the risk or lead to baby or sexually transmitted infections. You have to be careful of that. And then obviously with this ripped glove, this happens often, especially because they're not latex anymore. This is most likely, this is nitrile, so they don't stretch as much. So if you pull it too hard, they can rip pretty easily. So wearing gloves, almost every time I have a patient encounter, it's your PPE, your personal protective equipment, and it's basically to prevent any soiling or transfer of disease and keeping everything clean, especially for the patient. Check out my new supplement company called Life Happens. These memes are good. They were very, very medically oriented, so I got most of them. They were quite funny. If you guys have memes out there you want me to react to, please send them my way. I'll definitely include them. And as always, if you enjoyed this, definitely check out this playlist right here. Make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.